Unprecedented advances in science, medicine, and other public health spheres have increased the life expectancy of our times as the best ever in the evolutionary history of mankind, which, however, also means that consumption of healthcare services has achieved an unprecedented high as well. And we know from our everyday life, every consumption leaves behind its residue, its waste. The waste generated at hospitals and other healthcare facilities is called healthcare waste. Some of this waste could be highly infectious.
Now let's imagine for a moment that there's a hepatitis B or hepatitis C or even an HIV positive individual here, and this is a hospital where waste management is not in place. Now this syringe, by virtue of pilferage, is going to go out into the market, go into the hands of unscrupulous traders who are probably going to just wash it with water, repack it with a nice label. What is the guarantee that your grandchild, who's just about a week old, is not going to get a BCG vaccination which is contaminated by a needle which is hepatitis B or C positive?
A hospital is meant to cure illness, not create it. But since there is healthcare waste being produced, there is also a chance that you will spread disease through it. That would defeat the very purpose of its existence. This healthcare waste could be infectious, and if you mix it with municipal waste, then you make the whole waste infectious. This waste is then taken out by the municipality to probably landfills where a large community of waste pickers scavenge.
If you have any kinds of bacteria, they will permeate all the other waste you have and goes out to the general community.
These landfills leach toxics that contaminates not just the environment, but especially the groundwater, which is the water we drink.
The efforts of our university, effort of Government of India, effort of UNDP, it is very appreciable, and the proper focus to this sector must be given. Otherwise, the waste produced by these institutions shall play havoc with the normal citizens.
Basically, it's a potential ticking time bomb. We have to cut this cycle of contamination. And the only way to cut it is to manage this waste separately and in a contained manner.
So it seems obvious that the matter needs to be taken seriously and dealt with professionally. It needs to be managed, and this process is called healthcare waste management.
It's part of the modern thinking. So a good doctor, a good administrator will look at infection control and waste management.
The onus, therefore, is on the hospitals. There have been many examples of hospitals where good waste management practices have been developed to become models for others to emulate. The JEF UNDP MOEF project has been working in Uttar Pradesh and Tamil Nadu to develop and implement model healthcare waste management practices. Be it a premium hospital or a primary health center, waste management is imperative.
You could have done all the hard work of a complicated surgery. You could have taken the person to the last mile, but if the person picks up something from your hospital because of bad infection control practices, all that good work, all the hard work of the doctors, the clinicians, the other support team goes to naught if you don't do that last mile.
The role of the Ministry of Health and Family Welfare is to provide for a system for management of all the potentially infectious and the hazardous waste which is generated in our healthcare facilities, and to manage them in accordance with the biomedical waste management rules which have been framed by the Ministry of Environment 1998 rules. We recommend a hospital waste management committee, and they should be reviewing all the actions which are required for proper management of the waste.
King George's Medical University, or KGMU in Lucknow, is part of the Uttar Pradesh component of the project.
This institution was established in 1905. It has got at the moment 49 buildings, 45 departments, 8,700 employees working. There are 350 faculty members, over 3,000 students, fellows, residents. This is the real poor man's hospital attached with this university. That's about 3,000 bedded hospital. So this is a huge institution with varied responsibilities.
The management of hospital waste comprises the following process: waste minimization, waste segregation, waste storage, waste transportation, waste treatment, and waste disposal. Generation of waste could be minimized by planning for using more reusable material instead of disposables like masks and caps. However, they would need to be properly treated or autoclaved before being reused. Dr. Kirti Srivastav is the member secretary of the Healthcare Waste Management Cell at KGMU. She believes that the first step towards the process is training all personnel on the subject. But what exactly is it that they train about? The first step is segregation, which is to segregate the infectious waste from the non-infectious.
If you talk about a hospital, around 80 to even 90% of the waste is non-infectious general waste. Only 10 to 20% is biomedical waste. So if you are not segregating the waste, then you are actually making this 20% to increase up to 100%, and then you have to treat the whole 100% of waste which is being generated in the hospital. So it's very important to segregate the waste at the point of generation.
Segregation means keeping different kinds of waste separately. All kinds of medical waste should not be mixed together, as different waste needs to be treated differently. There should be separate colored bins for different types or class of waste. These principles of segregation are followed by all project partners, be they in Lucknow or in Chennai, be they hospitals or medical labs. In this hospital, waste is collected into primarily 5 different colored bins as notified in the BMW or Biomedical Waste Management rules. In this procedure, the doctor follows appropriate safety and waste segregation practices. The red colored bin collects recyclable plastic waste such as gloves, syringes, IV bottles, catheters, etc. The incinerable waste is collected in yellow bags. This waste includes non-plastic infectious waste like cotton, gauze, bandages, human and animal anatomical waste. The whole glass bottles, vials, etc. are contained in a puncture-proof container, while the broken bottles come under the category of sharps waste and are collected separately. The sharps waste. The needle sharps are collected in the box of the hub cutter. The hub cutter box itself is taken for treatment. Then there is infectious liquid waste as well as chemical waste. As this institute is rather large and scattered, an effluent treatment plant or ETP was found to be unfeasible. In such a situation, the infected liquid waste, which could be generated from ascitic taps or a pleural effusion tap, etc., is treated and disinfected on site. This waste is collected in blue-colored bins in 10% hypochlorite solution. It is then left for 30 minutes and then drained. Lastly, the non-infectious general waste like paper, wrapper, food material, etc. goes into the black bin, which is collected and sent to the municipality for disposal. Once the procedure is complete, the waste is then trolleyed back to the base hub, where the bins are emptied into appropriately colored storage bins. Using a face mask for protection, the worker empties the waste from the red bin into the red drum, the yellow waste into the yellow drum, and likewise. All segregated waste is stored temporarily in these drums till it is collected for transportation to the Central Collection and Treatment Site or CCTS.
Another important thing is that the whole process of waste collection is totally a covered process, and nowhere the person who's coming for collection comes in contact with the waste. The bags are zip-locked, then they are transferred into a covered trolley, and then whenever the waste is collected from the bin, then it should be zip-locked or so that it doesn't trickle at the time of collection, and proper signage should be there, and weighing is very important at the site of generation so that the record keeping is perfect.
When the waste is properly segregated, the next step is transportation of this waste to the treatment site. The important thing to note is that the infectious and non-infectious waste must travel in separate trolleys and should not be mixed. Even at the CCTS, they are kept in separate rooms. At King George's Medical University, a special waste tracking mechanism has been developed. Since the campus is huge and spread over more than 1.5 square kilometers, it is important to make sure that there is no pilferage.
When the waste is collected from individual collecting points, the bags are ziplocked and there's a barcode there which is scanned into the system. So essentially each bag as it leaves the collection point is scanned into the system.
This bag keeps showing up as a pending bag till it reaches the CCTS, where it has to be scanned out of the system after being reweighed. This ensures that every bag that has left the point of generation has reached the central site without pilferage. Besides the waste that has been discussed here, there are other healthcare wastes that need to be handled carefully. One of them is mercury. Mercury waste needs to be managed with care. In this ward, a nurse accidentally breaks a mercury-based thermometer. She proceeds to demonstrate how this waste created needs to be managed. Open all the windows so that the noxious fumes escape out. You must have a mercury spill management kit which can be easily put together. Put on your protective mask and gloves. The first step is to collect the spilled mercury at one place with the help of any hard and stiff material. Then, with an open syringe, suck in the mercury into it. Collect all the droplets into the syringe. Empty the mercury from the syringe into a box that contains 10 to 15 ml water. Seal the box carefully. Use sticky tape to clean up any small portions of mercury that may have remained. Then, put all the collected waste and the material used into a zip pouch. Label the pouch as mercury waste and hand it over to the waste disposal personnel. Blood, when spilled, could also be infectious. First, secure the area. Pour 10% hypochlorite solution over the spill. Wait for about 30 minutes. Wipe off the entire thing with appropriate absorbent material. Dispose it off in the red-colored bag. And then mop the area. Infection control also means safe and hygienic care processes.
Because of hand washing, we can prevent 90% of infection. Now, according to CDC and WHO, we are following 7 steps of hand washing. And whenever we go to the patient, we have to wash our hands, and we are following 5 moments of hand washing, whatever is given by WHO. And we are doing hand washing surveillance in the hospital.
Washing of hands before and after any medical procedure by professionals could prevent a majority of hospital-acquired infections. And there is a correct way to wash hands to prevent infection. This nurse demonstrates. With wet hands, take the solution and lather it. Then, follow this procedure. Rub palm to palm for 10 seconds. Palm to palm, fingers interlaced for 10 seconds. Right palm over the left orsum for 10 seconds. Left palm over the right orsum for 10 seconds. Back of the finger to opposing palm and vice versa for 20 seconds. Then rotationally rub the right thumb and vice versa for 20 seconds. Lastly, rotationally rub tips of the fingers of right palm in left palm and vice versa for 20 seconds. Hands should be thoroughly rinsed under running water for 10 to 15 seconds. Having seen the practices of segregation and other safety procedures, the next step in management of hospital waste is treatment and disposal. For this, a separate unit has been established at KGMU which is dedicated to this process.
We concentrated on developing the site for the collection and terminal disposal. This is our central collection and treatment site. The site has recently been developed and is specifically dedicated for the collection and then final disposal of the waste which is collected from the hospital. So this is a very big hospital, and the waste from the various workstations of the hospital comes in these rickshaw trolleys. And then the waste is deloaded into the various areas of this building. The trolley which is containing the infectious waste that comes to this place, and the waste is deloaded from this door. So this is our infectious waste room where we store our infectious waste. So all the infectious waste which comes in red and yellow bags is stored in this room. And here you can see there are two sort of trolleys. One is for incinerable waste, where we store our yellow bags in which we segregate the incinerable waste, and which is finally loaded into this. We weigh the bags here on this scale, and then it's loaded onto the vehicle which comes from the CTF, the Central Treatment Facility, which is Synergy right now, with which we have the contract.
The red-colored bags are stored separate from yellow bags for autoclaving. These bags are weighed and a record maintained.
And the bags from this trolley, they are brought to the autoclave machine. These are the two autoclave machines which are used for sterilizing the plastic and the recyclable waste. And in these machines, the bags are loaded first. After being autoclaved, these bags are stored into this trolley. These bags are then taken into this room. This is our segregation room. Here the different categories of the plastics are being segregated into different groups, like gloves, pipes, syringes, cannulas. They are all separated into different categories. These are two shredder machines which are used for shredding the plastic material. So the different categories of plastics are being shredded separately here, so that then they are finally packed and resold.
Similar operations are conducted on the autoclave at GJ Multiclave, which is a common treatment facility or CTF outside of the limits of Chennai city. On this visit of Mr. Edward, global project consultant, he proceeds to test the autoclave machine for its efficacy.
All right, what we're going to do here is set up a data tracers and biological indicators to evaluate an autoclave. And there you have your data tracer, your biological indicator, and your integrator.
He attaches bioindicators to a stick and puts them into the waste bags that are to be autoclaved. At the end of the autoclave cycle, the indicators are removed and put in an incubator, at the end of which the results are noted and the efficacy of the operation is evaluated. The sharps waste is perhaps the most hazardous waste that needs to be handled carefully to avoid incidences of needle prick injury. The sharps waste is collected in the puncture-proof hub cutter boxes, and these containers are directly sent for autoclaving and disposal to the CCTS. One of the methods of sharps waste disposal after autoclaving is by way of sharps pits, as is followed at GJ Multiclave.
Well, in the most simplest term, incineration means that you combust something. And when you combust waste in a controlled manner, that means in a temperature controlled manner or in some kind of device which has some kinds of checks and balances, an engineered device. This term is loosely called incineration.
But you cannot burn anything and everything in an incinerator. Only non-plastic waste is put to incineration. That is because incinerating plastics can release dioxins and furans.
Well, dioxins and furans are a class of chemicals called organochlorines in technical terms. They are two classes of or families of chemicals which are made from chlorine and from hydrogen and oxygen, set up in certain molecular structures. But when they are released, then they are some of the deadliest toxins known to man. Very small quantities of dioxins, furans can enter your body and stay there for a long, long time, and can also pass on from mother to child. That means the intergenerational toxics.
Dioxins and furans are also hormone mimics. They are mistaken for hormones in growing children, and this could cause chaos. Long-term effects can be cancer. They also have long-distance transport capability, and so they can spread globally. They are among the most hazardous chemicals that man has created. There are legal matters that relate to incinerators.
At the global level, there is the New Stockholm Convention, which was signed in 2002, and it really deals with chemicals like dioxins and furans. And there is a section which talks about unintended byproducts of combustion, which is essentially incineration. So there is a global agreement under the treaty, and India is a signatory to the treaty, to reduce the amount of dioxin furans to the minimum.
At GJ Multiclave at Chennai, which is a common treatment facility and which is a project partner of the UNDP JEF MOEF project, the van that has collected the waste from various healthcare facilities arrives hours later.
This was established in 2003 June with the help of the Indian Medical Association and with a lot of support from the Tamil Nadu Pollution Control Board, who are the regulatory authorities for the whole thing. And when we started out in 2003, we started out catering to about 2,000 beds a day. And today, we're very proud to say that we do about 450 different healthcare establishments in Chennai and cover about 13,000 private beds and about 5,000 government beds. We collect about 5 to 5.5 tons of hospital waste every day.
This waste collected from various healthcare facilities is segregated, and then the incinerable yellow bag waste is fed into this incinerator machine.
It has two chambers. The one is primary chamber and the other one is secondary chamber. Automatic feeding system we have. And the other one is manual. We're using automatic feeding system.
The automatic feeding system opens every 10 minutes and will automatically push the bags into chamber 1. The primary chamber maintains a temperature of 850 degrees centigrade plus or minus 50 degrees centigrade. The bags are loaded when the temperature reaches 850 degrees. From there, the flue gas goes into chamber 2, where there is a secondary burner where the temperature reaches 1050 degrees centigrade plus or minus 50 degrees. From there, the gas goes into Venturi scrubber. There are two sprays. One is fresh water and the other being recycled water. And then there is the water tank or the circulation tank. There is a pump here that circulates water maintaining a pH value of 7 and above. Then the gas goes into the droplet separator. From there, it goes to back scrubber and water shower. Then to the mist eliminator, which collects moisture content from the effluent gas. This gas finally goes to the 30-meter chimney through the induced draft fan. Cleaning of vehicles after the collection and offloading is a must, so as to make sure that infection does not travel. This is strictly followed at GJ Multiclave. Finally, we see the effluent treatment plant. It is important to have an efficient ETP to make sure you are concluding the entire process of waste management effectively. After the effluent is treated in the plant in multiple steps, it finally collects as a sludge. This sludge and the ash collected are sent to the final hazardous waste treatment and disposal site.
Well, mercury has been used for the last many hundred years, 200-300 years, as something which you measure. It's a measurement liquid. So in thermometers, in blood pressure instruments, it's very commonly used now. Unfortunately, in the last 30 years, we found that it has very, very significant health impacts. Very small amounts of mercury can cause contamination to the food and can come into the body. And they have very long-term impacts on human health.
just like loss of memory, difficulty in walking, visual deficits, vision loss, and then abnormal sensations. Because of this mercury exposure, there are a lot of health problems occurring in human beings, which leads to renal failures or liver toxicity, and of course, the foremost is the CNS or nervous system toxicity.
Now there is a new treaty being negotiated at the global level, which will be concluded in 2013. And the UN, it's a multilateral treaty like the Stockholm Convention, which will talk about the reduction or the elimination of mercury from the global stage.
The BP instrument, I feel, has a large amount of mercury in it. So if a BP instrument breaks, there could be a lot of mercury vapor being formed, which can be inhaled. So the alternative is using aneroid BP instruments and digital thermometers instead of mercury thermometers. Even for the tooth amalgam, you can have different type of dental materials which don't contain mercury. So there are alternatives if you are aware about them, and if you want to use something else, there are alternatives available.
Many healthcare institutions have been working at eliminating mercury in instruments like thermometers, blood pressure instruments, and other dentistry-related treatments. One of them in Chennai is Rajan Dental.
Since 2007, we had our initial plans to do away with mercury-based restrictive materials, and this plan was successfully implemented since 2010. The reason why we are able to outface silver amalgam restrictive materials is because we have good alternatives to silver amalgam restrictive material like composite resins and glass ionomer restrictive materials, which are not alone mercury-free but are also tooth color restrictive materials, which enable good sense of aesthetics, and patient satisfaction is also very good with those kind of restrictive materials.
After this mercury guidelines, that was even in the form of an advisory to phase out the mercury. But even after issue of this advisory, the independent studies have revealed that it has greatly reduced the use of mercury in our country, mercury-based equipment, and the phase out is happening.
आप लोग को मालूम है हमारे यहाँ वेस्ट डिस्पोजल की ट्रेनिंग हुई थी, आप सभी लोग की ट्रेनिंग हुई थी, जिसमें सिस्टर्स की अलग हुई थी, डॉक्टर्स की अलग हुई थी, सफाई कर्मचारी और सबकी हुई थी ट्रेनिंग.
Training and monitoring are two things that are taken seriously by the administration when it comes to healthcare waste management. This monitoring opportunity is taken by the doctors to give the duty nurse a brief rundown of the waste segregation procedures.
General waste material you will consider जैसे wrapper है, gloves wrapper.
Then a record is kept and ratings given on the ward's segregation practices.
ठीक है, गुड सेग्रीगेशन कुछ लैक्यूना है वो लैक्यूना लिख देते हैं और गुड सेग्रीगेशन प्रैक्टिसेस ये लिख देते हैं.
Now we have training for all staff, whether you're a contractor staff or not. Great that you're giving them training. Great that they're trained in hospital waste management practices. Take that to a level up. Explain the context of why and involve more people. So now the training has a much more holistic approach and a much more multi-participatory approach with the explanation of why certain things are important. That helps.
Indira Gandhi National Open University, or IGNOU, has been a training partner on healthcare waste management on the project.
See, the program of healthcare waste management was conceived in around 2003-04 when WHO had approached IGNOU to develop a program for sensitizing and imparting knowledge and changing attitude and inculcating the practices of safe management of the hospital waste. Since then, we have been able to train more than around 1,000 students already.
IGNOU has also developed a web-based certification program on healthcare waste management, which is unique in the world.
All these programs, though these are being offered through open and distance learning, we follow the curriculum which are similar to the conventional system, and we have a strict evaluation system.
The important part in this course is this, 420 hours is study period, and among this 420 hours, only 90% study what the candidate have to do self-study, and only 42 hours is contact session. 42 hours is equal to 6 days. 6 days contact session are there. So beside performing routine work of doctors, they can also perform this course. So this does not make hurdles in their routine work. So this is important.
Healthcare waste management is not just the right thing to do, but it is a legal obligation. Biomedical waste management rules were notified in 1998 by the Ministry of Environment and Forests, Government of India. They were amended in 2003. The latest amendment of the rules is due for release in 2013.
What we want to understand and what we want to put to the health staff is biomedical implementation of biomedical waste management is not separate in attitude when compared to infection control waste management. We want everything to be practiced in a single shot so that to have a better efficacy.
See, right now all the healthcare facilities should run with the authorization as well as consent, permit, that is permit. Normally the Pollution Control Board, Tamil Nadu Pollution, especially Tamil Nadu Pollution Control Board will give you the authorization for disposal of their healthcare waste to the common facilities. By personal, maybe we can take it as an advice or we can take it as an authority. See, since we are a regulatory authority, see, everybody has to implement whatever the direction given by the either by the Pollution Control Board or by any healthcare institution or by Government of Tamil Nadu. We should implement and follow it immediately.
After this implementation of this program, lot of changes are there. The segregation is being done very properly. Everybody is aware about this waste management. Nodal officers are working very hard. So it has come up to the you can see up to the optimum level what should be there. Now we are trying to maintain this. I hope we will be successful for doing this.
Implementation of healthcare waste management practices is improving day by day. Segregation at the project hospitals has achieved great success, but the journey is never ending. For better management practices, education and motivation have to be ongoing. The practice has to sustain a state of self-discipline among all cadres of medical professionals. The JEF UNDP MOEF project has achieved its set objectives of developing model practices. These practices now have to be implemented in the rest of the country. Only then will there be safe and hygienic health centers and a clean environment for all to flourish.